Okay, so all students, sir, I would be starting the program. In all horizons, women are considered and called creators of life. Is it easy? Someone asked her. She replied with all smiles and grace, it is powering. Why do women bleed? She bleeds for glee. She bleeds for happiness. She bleeds to push a new life. Menstruation is an inevitable part of women's life. Menstrual cycle is not just tied to reproductive aspect but contributes to an overall well-being of a woman. Good afternoon, everyone. Today, I, Vanipriya Singh, on behalf of Lakshmi Chand Golwala College of Commerce and Economics, welcome you all for the guest lecture on Un Dino Ki Baatein by Dr. Vishal S. Kelkar. Thank you so much, sir, for joining us for today's lecture. I would now request Asha Verma ma'am to introduce our guest lecture for today's session.
Yeah, thank you, Vanipriya ma'am. Dr. Vishal Kelkar is homeopathic doctor and founder and director of Healthshore Homeopathy and Wellness Clinic in Pune. Dr. Vishal is dynamic and passionate homeopath who specializes in treating various health issues faced by females, children problems, joint pains, and all stress-induced disease with the help of homeopathy. Along with being a homeopath, he is also a certified music therapist and flower remedy therapist and applies his expertise to achieve overall wellness of his patients. So, I welcome you on behalf of our college. It is privileged to have you here with us. Now, I request our principal, Dr. Sunil Karve, to welcome our guest speaker.
Thank you, Asha. I once again welcome Dr. Vishal, and really he deserves a welcome from our side, not as a today's guest, but then he joining us from Pune. He works with his another colleague, Prachi. She is also a physiotherapist, and she also looks after this kind of the area. Today she was busy, so she did not come. But Vishal, in spite of his all OPD and all other assignments with a very short notice, when I met him at Pune, he immediately said, yes, sir, I'll definitely take a session. So that is what Dr. Vishal, I really again welcome you and thank you for accepting our invitation. And then this is a very important topic because in India, especially as a broader platform, if we say, there is a taboo, there are some misconceptions, there are so many blind beliefs And then when we move to even rural areas, especially Adivasi areas, the situation is not so good, which any of the girl should be proud of this, but then they are insulted because of this kind of the menstrual cycle. So I hope everybody will enjoy, and then Brushal will give insight to the whole thing. Thank you, Dr. Brushal, and also thank you, Asha and Vani. Thank you very much.
Thank you so much, sir. I would now request, sir, you can start with your presentation.
Okay, okay. Am I audible?
Yes, sir.
Yeah. So thanks a lot. Thank you, everyone. And thanks to Dr. Sunil Karve, sir, and whole team of Golwala College and all the organizers for inviting me here to talk upon this very, very important subject. And it's my pleasure to be here with you all. Okay. I welcome all of you participants. Oh, okay, okay. More than 100 participants are there. That's great.
And sir, we
Okay,
are live on YouTube also, so there are students watching you there.
great. Okay, okay. Okay. So shall I share my screen?
Yes, sir.
Okay. Is it visible? PowerPoint presentation?
Yes, sir, it's visible.
Okay. Yeah. So good afternoon, everyone. Let's start with our today's topic about awareness about menstrual hygiene and health. उन दिनों की बातें हैं. Okay. So
Sir,
the
just a
slide is
second.
getting changed.
Um, the
Yeah, yeah.
slide, yeah. Sir, could you please switch off the annotation from your side? If you're sharing the screen, there would be a panel display. Oh, yeah. Last, could you click on more?
More. Okay.
Yeah. Sir, disable annotation for others. After copy, streaming link. Yeah.
हाँ.
Yeah, just. Thank you so much, sir. That's
हो
it.
गया?
Yes,
Okay.
sir.
Yeah. Okay. Thank you. So first, let us understand the basic structure of female reproductive system. In short, so the most of the participants here are already in the age after menarche. So we will cover up this topic bit quickly. So this is the diagram of our female reproductive system. And are you able to see my cursor?
Yes, sir.
Okay, okay. So this is the ovary, this is fallopian tube, and this part is the main uterus. This is cervical part, and this is vaginal part. Okay. So if we consider our menstruation cycle of 28 days, then the follicles from ovary here get matured from around day one to 13th day of the cycle. Then I will try to use simple language and try to avoid the complex medical terminologies. Okay. So once the follicle is matured, we can call it as ovule. So that egg comes out from here, then through this fallopian tube, it travels to here. And if the sperm comes from here, then their fertilization takes place, and that embryo comes here and sits here. Okay. So in the anticipation of all these things, our uterus forms a good cushion for this embryo. And if the fertilization does not take place, then what to do with this cushion? Then that all proliferated endometrium, we say. So all that proliferated endometrium comes out through the vagina here, and that we call usually as the bleeding phase of the or of the menstruation cycle. So we will move to next slide. So follicular phase is from 6th to 13th day. Then ovulatory phase, the phase where ovule comes out and everything, is around the 14th day. And luteal phase, where this endometrium gets proliferated here, एक गद्दी जैसी बन जाती है एम्ब्रायो के प्रोटेक्शन और अटैचमेंट के लिए. तो यूटेरस ये बनाता है क्यों? क्योंकि अगर बच्चा है तो उसके प्रोटेक्शन और नरिशमेंट के लिए ये सब बनाता है. लेकिन अगर फर्टिलाइजेशन नहीं हुआ तो फिर क्या करने का? इसलिए वो सब जो प्रोलिफरेटेड मैटर रहता है वो थ्रू द वजाइना it comes out. Okay, so and luteal phase from 15th day to 20th day, and the bleeding phase from 1st to 4-5 days. That we usually see externally as menses or periods, usually called as. Okay, so the menarche, age of menarche is around 12 to 16 days. Normal duration of this bleeding phase is from 3 to 7 days. Normal length of menstrual cycle is around 21 days to 35 days. So see, the biology is not like mathematics कि अरे इसका आंसर ये है तो यही आना चाहिए, ऐसा कुछ नहीं है. Everyone is beautiful in his or her own way, right? So there is always a time span given, or the average is given. So अगर आपकी menstruation cycle 21 days, 24 days, 26 days की है या 32 days की है तो भी it is normal. या फिर कभी 1-2 दिन से आगे पीछे हो गया, if your menses get delayed or preponed by 1 or 2 days, then it is fine. 1 or 2 days, that is fine totally. ચિંતા કરવાની જરૂર નથી, બધું સારું છે, બધું નોર્મલ છે. ઓકે, so basically you are commerce student, so आपकी भाषा में बताना तो biology is totally different, and it is not like balance sheet कि सबका सेम आंसर आके सबकी टैली होनी चाहिए, ऐसा कुछ नहीं. सबकी अपनी अपनी बैलेंस शीट है, सबकी अपनी अपनी जैसे टैली होगी. ओके, and it is a very natural process of our body, as our principal sir said just now, Dr. Karve sir, कि it is usually a taboo topic जो समझा जाता है, लेकिन ऐसा बिल्कुल भी नहीं होना चाहिए. It is very natural process of our body. So if you are having menses, then you are blessed by Mother Nature and you are totally normal. So my request to all of you present here and those who will be listening to this afterwards, please do not call your period as problem. Okay, so if you call it as problem, it will create problem. ठीक है, say whatever you want, periods, menses, etc., but do not call it as problem. The normal periods can occur without any pain or any troublesome symptom. That can also happen. But if you experience following symptoms in mild to moderate intensity, that is also normal. So like cramps, in abdominal cramps, or extremities में tenderness or heaviness of breasts, bloating in your abdomen or stomach, mood swings, irritability, headache, tiredness, etc., low back pain. So if you are okay, wait, let me start the slideshow. So if you are able to see these two women of white top, if the intensity is like this, then you are normal. But if the intensity is like this black and white photo, then there must be something going wrong inside. So you need to see your doctor. Okay. Hello ma'am, the screen is visible, the title is visible or not? Because
Sir, it is getting cut a little bit, but it is visible.
Because this black bar is there on
Sir,
the
you
title.
can
Ah,
you can
that's it.
stop the slideshow. It was normal previously also when you had not. Yes, we can see it.
Okay. So if
Yeah, it's visible. It's visible. When to see your doctor.
हाँ, ठीक. Thank you.
Thank you, sir.
So, so if you are experiencing PMS, it is called as pre-menstrual syndrome or symptoms with great severity. So these pointers you can take a screenshots, students. So when to see your doctor, because if you know what is normal, then you will be able to judge what is abnormal. So all these things are normal when these things are in the mild intensity. Okay. So if you are experiencing PMS with great severity, unbearable abdominal pain. So I know many of my patients who used to bear that unbearable pain, and आई डोंट नो हाउ दे कुड, बट ऐसे ही वो तड़पते रहते थे. उनको पता नहीं था कि अरे इसके लिए दवाई लेकर ले सकते हैं या लेना चाहिए, क्योंकि अरे पीरियड्स में तो पेन होता है, लेकिन इतना बाबा अनबेरेबल है तो आप मेडिकल एड उसके लिए जरूर ले. ओके. सो सेकंड इज यूर इफ योर पीरियड स्टॉप्स सडनली, you are bleeding for more than days than usual, you are bleeding more heavily than usual, you have severe pain during periods, bleeding in between periods, suddenly feeling sick. This point is important. If you think you might be pregnant, for example, you have had sexual intercourse and your periods are delayed at least by 5 days. Your periods has not returned within 3 months after stopping birth control pills, and you are not pregnant. You have any questions or concern about the period or possible pregnancy. So for these purpose, you need to see your doctor. Okay. So the very important topic of today's lecture, menstrual hygiene, because I know most of all, or rather all of you are in the menstruating age. So the basic you must be knowing. So this menstrual hygiene and all other parts are more important for you. So I will be focusing on these parts more. Okay. So if does not maintain the proper hygiene, then it can lead to uh, hmm, I will do like this better. Hmm. Then it can lead to bad odor, obviously, infections of urinary tract, perineal area, reproductive system, like fungal infections or bacterial infections, etc. And due to the dampness, wetness there, and the lowered pH widened cervical opening, the chances of infection are more. Then the third is toxic shock syndrome. We will get back to this toxic shock syndrome when we will be discussing about tampons. Okay. So these are the few tips. You can take a screenshot of it. The cleanliness, very important. So daily bathing is required and advisable. The cleaning of vaginal area, hygiene wash spray you can use to increase the pH. But remember, my friends, it is to be used externally only. Do not put that spray in the inner part. Okay. Then clean your hands with soap and water before and after the uses of sanitary napkins or other products. So usually जो ये जो भी मैं बोल रहा हूँ ये either कुछ मतलब ऑथेंटिक सोर्स बुक से है, आइदर वेबसाइट से है कोई ऑथेंटिक, या फिर जो मेरा एक्सपीरियंस रहता है पेशेंट्स के साथ, उनके साथ का जो मैं आज भी जो भी मटेरियल आपके साथ शेयर करने वाला हूँ वो है. तो बहुत बार सैनिटरी पैड यूज करने के बाद हाथ साफ करते हैं फीमेल्स, लेकिन वो यूज करने के पहले हाथ साफ करना भूल जाते हैं. सो डोंट forget to clean your hands with soap and water, because otherwise it can facilitate the infection there. So Then this is also very important. No jet spray or hygiene wash inside vagina. The good bacteria can get destroyed or external dirt may go inside. While washing, do not clean from backside to front side, because at the backside our anus or rectal area is there. So instead, clean from the front to back with jet spray or with napkin also, to avoid rectal material going inside vagina. And obviously dry it properly after the cleaning. Okay, if you want, you can take the screenshot of this or photo. Then various products in the market which help to maintain menstrual hygiene, such as sanitary napkins, tampons, menstrual cups, panty liner, etc. So avoid gharelu clothes if you are using cotton cloth, like older times. But I guess all of you are in the Mumbai area, so I hope you are not using cotton clothes. But if any one of you is using such material, then wash it thoroughly with the soap and water and keep under sunlight for drying before using it. Okay, for disinfection and sterilization. Then use disposables to decrease the chances of infections, because if you do not clean the reusable things properly, it may lead to, or it will lead to infections. Okay. So if you are using yeah, that is over. Right. So sanitary napkins. Okay. Hello, I hope you all are with me. બધા મારે સાથ છે ને? Because I can understand the afternoon timing and post lunch session, so sleep over powers, but you are Mumbaikars, so I hope कि हमारे पुणे जैसे आप एक से 4 बजे तक सोते नहीं रहोगे. So clap or shake your heads, move your arms and be with me. Okay, ठीक है. So sanitary napkins, we will see about this. So advantages, easily available, it is very convenient to use, no insertion inside vagina, and it is disposable, so no chances or less chances of infections. And disadvantages, needs to be changed frequently, leakage can occur, not reusable, and hence less cost effective, and may be visible from outside, because some females का वो concern भी रहता है. तो but in all, sanitary napkins are convenient to use. The two types are commonly available: the plastic based, which are easily available in any medical shop, but that are less recommended due to the use of plastic material inside, and that's why it also becomes non-biodegradable, hence create much of plastic waste. And the second type is cloth based. These are highly recommended actually, but it is comparatively costly, but it is biodegradable, so it is actually recommended. So the awareness must be spread, and at less price, these cloth based sanitary napkins should be available for girls. Okay, so various sizes available, choose according to your day of menstruation, flow and comfort, etc. Change it every 4 to 6 hours. This is very important. According to flow, the hours will change obviously, but it is not at all recommended to keep it more than 6 hours, because it will lead to infections and unwanted complications. Okay, so this is very important to change it. Take a new one for night time, because otherwise बहुत टाइम वो वैसे ही रह जाता है अंदर. Then how to dispose a sanitary pad. This is also very important thing. You can take a screenshot of it. So after taking out cautiously from your undergarment, roll it, then put it in a newspaper disposable paper bag, etc., and pack it. Discard it off in a separate bin bag. Please do not throw. This is uh, also very important. Please do not throw it or flush it in the toilet. It will get clogged. Hmm? So also do not throw outside on roads and with your regular daily wastes, etc. So ideally, according to the guidelines, use specialized bean bags with red dot, or pack it in a paper bag and put red bindi on it, so that cleaning workers and housekeepers can identify it and differentiate. And especially in girls' hostels, request your authorities to install a machine called as an incinerator. So the sanitary pads get burnt and destroyed there. So हॉस्टल में रहेगा तो आप उनको रिक्वेस्ट करके देखो कि वो इंसिनरेटर मशीन उधर इंस्टॉल करे, so that will be easier for you all. ठीक है. So next one is tampons. So this is also a product available for menstrual hygiene like sanitary pads. So the tampon is available in various sizes according to the size of vagina. It is to be inserted inside the vagina, and it is made up of some absorbent material, so it absorbs the menstrual flow and blood. Okay. So advantages of tampons are: it is inserted inside the vagina, hence less chances of leakage. It cannot be seen from outside in spite of tight clothes. So see, it is recommended not to wear too tight clothes when you are menstruating, but कोई मीटिंग है या कुछ unavoidable thing है तो you can use these tampons. It is said that one can also swim while wearing it, but again, if you are not a professional swimmer, it is advisable to take rest and not to go at swimming wearing tampons and while you are menstruating. Take rest, it is always advisable. Smaller in tampons are smaller in size too, so you can carry it during the travel time, etc. And disadvantages are: inserting something inside vagina can be felt uncomfortable by many girls when it is not habitual, or if one forgets to remove it, it can lead to toxic shock syndrome. So this is very important. तो ऐसे केसेस हुए हैं कि वो इंसर्ट करने के बाद वो फीमेल्स भूल गए कि अरे ये ऐसा किया है, और उधर सेप्सिस होके फिर वो टॉक्सिक शॉक सिंड्रोम नाम की बीमारी, मतलब एडमिट ही करना पड़ेगा उसके लिए. तो डू नॉट फॉरगेट टू रिमूव दैट इफ यू हैव इंसर्टेड. उसका भी अराउंड 4 to 6 आवर्स ही है अकॉर्डिंग टू योर फ्लो. एंड हाँ, सो डिसएडवांटेज ये टोटल नहीं है, लेकिन नीड ऑफ प्रॉपर टेक्निक टू इंसर्ट एंड रिमूव इट, बिकॉज सैनिटरी पैड्स यूज करने के लिए कोई ज्यादा स्किल की जरूरत नहीं पड़ती, लेकिन टेम्पॉन्स के लिए वो एक बार आपको टेक्निक आ गया तो फिर आ गया, तो वो आपको प्रैक्टिकली करना पड़ेगा. हेंस आई एम नॉट वेस्टिंग अवर टाइम for explaining you how to insert that and put applicator, and you can remove it by pulling the thread out, etc. I'm not telling because that is to be done practically. ऐसे बता के वो नहीं होता है. ठीक है, जस्ट मैं आपको ये सब बातें बता रहा हूँ, अवेयरनेस क्रिएट कर रहा हूँ कि you can try using it. Okay, so the third one is menstrual cup. Also, this is very, very important. It is a small, flexible, funnel-shaped cup made up of rubber or silicone, which is to be inserted inside the vagina to collect menstrual fluid. So, tampon के जैसा ये भी vagina के अंदर insert करना रहता है. और सी ये ब्लू वाला आप देख रहे हो स्क्रीन पे, तो वो ऐसा फोल्ड करके एस शेप सी शेप ऐसे रहता है उसका, तो ऐसा फोल्ड करके वो इंसर्ट करना होता है. दैट इज ऑल्सो technique to be learned. So advantages of menstrual cup is that it is reusable. So sanitary pads and tampons are not reusable. So menstrual cup एक बार purchase किया तो you can reuse it. But again, mm, the cleaning procedure is very, very important for menstrual cup to reuse it. Okay. Once, so less chances of leakage and safer than tampons. So tampons क्या होता है, absorbent material के होते हैं, तो कभी कभी the moisture or the wetness which is required inside vagina वो भी वो absorb कर लेते हैं, तो कभी कभी dryness of vagina, itching ऐसे problems देखे गए हैं, तो वो menstrual cup में ज़्यादातर नहीं होता. So and it also collects more amount of blood, so no need to change it frequently. You can wear it with IUD, मतलब intrauterine device for birth control etc. inside, and it is also not seen from outside. So the disadvantages of menstrual cup are again the same thing. Inserting inside vagina can be felt uncomfortable. Need of proper technique may cause allergic reaction, but the incidences of these are very less. Okay, and the very, very important is proper disinfection and cleaning of cup should be done, otherwise it can lead to serious infections. So उसके एक अलग से क्लीनिंग के लिए क्लीनर्स भी आते हैं, या जो सोप एंड वाटर एंड एवरीथिंग डिसइंफेक्शन वो करके फिर आप रीयूज करना recommended. Okay, then yeah, the beware of such gimmicky products in the market. So hygiene wash inside the vagina, कि vagina साफ होगा, साफ सुथरा होगा. So big no. Our body has its own mechanisms, so no need to put or spray something inside vagina. Then vaginal perfumes की आप smell करते हो तो आप perfumes मारो. No, because it can irritate the skin there. It is not at all advisable. And some detox liquids, powders or ads like ये दवा ले लो या ये liquid ले लो and get cured within just 1 day or just 72 hours, ऐसे ads आते हैं ना. So please do not fall prey to such ads. Don't trust such ads. Okay. Yeah. So the topic of menstrual hygiene, we have done with that topic. And if you feel or have any doubt or myth regarding this all related to menses, you can note it down, write it down, and you can ask me at the end of our session. ठीक है, जो भी डॉक्टर समझ के, फ्रेंड समझ के, ब्रदर समझ के, जैसा आपको कंफर्टेबल लगे आप मुझे पूछ सकते हो बिंदास्त. ठीक है. Okay, so let's move towards the PCOD or PCOS, the very, very commonly seen nowadays in young females. So पहले तो ये कुछ एज के बाद होता था, लेकिन अभी फ्रॉम वी कैन से 20s के बाद में तो ये बहुत से लड़कियों में पाया जाता है. सो पॉलीसिस्टिक, हाँ, सो पीसीओडी एंड पीसीओएस ये सेम है क्या, डिफरेंट है, ऐसे बहुत सारे पेशेंट क्वेश्चंस पूछते हैं. तो पॉलीसिस्टिक ओवेरियन डिसीज मतलब पीसीओडी, पॉलीसिस्टिक ओवेरियन सिंड्रोम मतलब पीसीओएस. तो प्रैक्टिकली देखा जाए तो पेशेंट के हिसाब से ज्यादा ऐसा कुछ जमीन आसमान का फर्क नहीं है इसमें. बस सिंड्रोम इज द कलेक्शन ऑफ सिम्टम्स. सो जब बहुत सारे सिम्टम्स साथ में आकर उसको हमें नाम देना होता है तब हम उसको सिंड्रोम बोलते हैं. और पीसीओडी थोड़ा माइल्ड टाइप का रहेगा, मतलब ऐसा भी डिफरेंशिएशन है कि अगर थोड़ा सा रहेगा माइल्ड तो पीसीओडी, अगर ज्यादा बहुत सिम्टम है तो पीसीओएस, बट इट इज नियरली सेम. ओके, so it is a hormonal disorder common among women of reproductive age, characterized by a group of symptoms such as irregular menses, weight gain, hirsutism, acne, oily skin, and with the presence of multiple follicular cysts in the ovary and increased androgen level and excess of insulin. So androgens are usually male type of hormones, सो उनकी लेवल बढ़ जाती है और फीमेल की, सब ये हार्मोन का गेम है, आगे पीछे हो जाता है। और जैसे इधर आप इस इमेज में देख सकते हो, अनवांटेड फेशियल हेयर्स आते हैं, मेंसेस इरेगुलर हो जाते हैं, एंड वजन बढ़ता है, हेयर लॉस होता है। तो ऑल दीज आर द सिम्टम्स ऑफ पीसीओडी और पीसीओएस. The major causes, it is said that the cause is not, exact cause is not known, etc. But if you see, the major causes are improper lifestyle, the late night movies देखते रहना, chatting करते रहना, lack of sleep, lack of exercise, और अल्कोहल और स्मोकिंग का ये बढ़ रहा है फीमेल्स में. तो अनहेल्दी फूड हैबिट्स, जंक फूड बहुत खाना, स्ट्रेस, stress is the major factor again, then hereditary obesity and improper mindset. तो improper mindset के बारे में हम थोड़ी देर बाद देखेंगे. Then what can happen ahead if one is suffering from PCOD? तो complications, it can lead to infertility, so this is the very bad thing to happen, bad, or rather I would say sad thing. Then risk of diabetes mellitus, risk of heart disease, obesity. See, the obesity is complication also and cause also. So obese है तो पीसीओडी हो गया, पीसीओडी हो गया तो ओबेसिटी बढ़ गई. So this becomes vicious cycle. Premature birth, miscarriages, depression, anxiety, and abnormal uterine bleeding, endometrial cancer, etc. So a stitch in time saves nine. So if you are suffering, or if you feel like अरे इसके जैसे कुछ सिम्टम लग रहे हैं मुझे, तो you should see your doctor and get it checked and start the medication for it at in the early phase to avoid further complications. Okay, just a minute, I will say if I have missed anything. Yeah, okay, okay. So everything is covered. And now, being a homeopath, I would definitely take this privilege to talk about homeopathy, of which the role is very, very remarkable in such conditions like premenstrual syndrome or PCOD, dysfunctional uterine bleeding, infertility, pregnancy related issues, hormonal imbalance, menopausal complaints, uterine fibroids, adenomyosis, etc. So, homeopathy is actually a holistic way of healing. So जो पेशेंट है उसका स्वभाव, प्रकृति, द ओरिजिन ऑफ दैट डिसीज एंड द डिसीज, ये सब कंसिडर करके मेडिसिन दिया जाता है. दैट्स व्हाई वी गेट सच अ गुड रिजल्ट्स. एंड इन स्पाइट ऑफ, मतलब without giving hormonal pills, such conditions can be treated very efficiently with the help of homeopathy. So homeopathy को अगर आप, अरे ये तो क्या मीठी गोली है, अरे नहीं होम्योपैथी स्लो एक्ट करते हैं, ऐसा अगर है तो वो इट इज टोटल मिथ. हेलो, सो इट इज टोटल मिथ. ऐसा
Yes, sir.
ऐसा कुछ नहीं है. एंड हाँ, या इसके बारे में मेरा एक वीडियो भी है यूट्यूब पे, आप यू कैन गो एंड चेक आफ्टरवर्ड्स, कि द मिथ्स एंड फैक्ट्स अबाउट होम्योपैथी बाय डॉक्टर वृषाल केड़कर, ऐसा आप सर्च करके देखो, मिल जाएगा. सो होम्योपैथी के बारे में ये सब कुछ है. ठीक है. सो नाउ द most important slide of today's lecture is this slide. Okay, you can, अच्छा इसको मैं हटा देता हूँ, ये ब्लैक बार को. ठीक है, यू कैन टेक अ स्क्रीनशॉट और फोटो निकाल के रखो इसका। तो बहुत सारे पेशेंट्स पूछते हैं कि अरे डॉक्टर साहब ये हो गया वो हो गया, पीसीओडी है तो हम क्या खाए, डाइट ये क्या करे वो क्या करे। तो या दैट इज इम्पोर्टेंट, ऑल दीज थिंग्स आर इम्पोर्टेंट, बट very very important thing is food for thought, that is your emotional well-being and what you are thinking about yourself. the, it plays important role. So आप क्या खा रहे हैं इसके साथ आप अपने इमोशंस और विचार के साथ आप क्या कर रहे हैं, ये बहुत ही इम्पोर्टेंट है। तो ये आपने आई होप सबने स्क्रीनशॉट लिया होगा इसका। तो ये आपको रोज कहना है आईने के सामने या आंख बंद करके कभी भी कि आई एक्सेप्ट माई सेल्फ एज अ गर्ल। अगर हमें टाइम रहेगा तो हम बाद में ये रिपीट करेंगे। सो द बेसिक aim is love yourself and accept your feminine features and accept that I am a girl, because बहुत बार जब कहते हैं ना कि स्त्री पुरुष समानता, हम समान है, तो मुझे तो ये जचता नहीं, बिकॉज यू ऑल वीमेन्स आर रादर ग्रेटर देन अस। सो आप नीचे क्यों आ रहे हैं? आपको नेचर ने ये इतना बड़ा ब्लेसिंग दिया है कि यू कैन प्रोड्यूस अ न्यू लाइफ। सी, सो विद ग्रेट पावर्स पावर कम ग्रेट रिस्पॉन्सिबिलिटी। तो वैसा है आपको। तो यार डर हर महीने को जब मेंसेस आते तो अरे यार ये क्या तकलीफ आ गया, ये क्यों दिया है, ये क्यों हमने क्यों ये सब सहने का, ऐसा बिल्कुल भी मत आप सोचो, बिकॉज दिस इज अ ब्लेसिंग। यू हैव दिस great capacity to produce a new life. Okay, so you are blessed and thank thank nature for this and accept yourself first as a girl. So आजकल जो पीसीओडी और इन सब का लेवल बढ़ चुका है, सो ये भी एक बहुत इम्पोर्टेंट रीज़न है कि जो अर्बन एरियाज में फीमेल्स है, उसमें से बहुत सारी फीमेल्स ऐसा अगर सोचती है कि अरे ये क्यों मुझे ये फीमेल बनाया, ये हर महीने का कटकट, ये तो फिर बॉडी वो कटकट बंद करने लगती है कि अच्छा नहीं चाहिए कि आपको मत लो, फिर अंदर सिस्ट बनना चालू हो जाता है एंड द टोटल साइकिल गेट्स स्पॉइल्ड। ओके, सो embrace and love yourself and love the thing that yes you are a girl. Okay, so this message is the crux or core of today's session, we can say. And if time permits, we will go through these sentences again in the end. Okay, but please take screenshot and uh, repeat it to yourself every day. ठीक है, मतलब आपने ये किया ना तो आपको ज्यादातर आप इस मतलब रिप्रोडक्टिव सिस्टम के बारे में आप आपके बीमार पड़ने के चांसेस बहुत कम हो जाएंगे इफ यू से these sentences to yourself. Okay, yeah. And yeah, this Health Sure Homeopathy and Wellness Clinic is the name of my clinic. And this is not actually advertisement but about awareness कि yes, homeopathy can help you in such cases very efficiently. Yeah, बाकी भी आप बाकी सिस्टम ऑफ मेडिसिन के भी आप जरूर हेल्प ले सकते हैं. I also appreciate other systems, but being a homeopath, I would like to say about homeopathy कि इस सब के लिए बहुत अच्छे रिजल्ट्स मिलते हैं होम्योपैथी से, और बेसिकली आपका जो हर महीने का सफरिंग है वो कम हो जाता है. ठीक है. And we also have the facility of online consultation, and medicines will get you will get your medicines at your doorstep by courier. And any problem, even after this seminar or webinar, if you feel any doubt, any problem, or any health related issue, you can always contact me on WhatsApp or by calling. This is my number. You can take a screenshot of this. You can ask me anytime, okay, without any hesitation. And yeah, this is my website, www.drvrushalkerkar.com. And yeah, we have also started our Instagram page. You can go and follow this page, because I'm planning to post some educational, means medical educational videos, or to clarify the doubts through short videos by this Instagram page. You can follow this. And yeah, this is about homeopathy for you all. And this is about yoga and physiotherapy for female health. So our ever shining, ever enthusiastic Dr. Prachi Kerkar. So she is a physiotherapist and yoga parangat, and she also takes online sessions, online yoga sessions also, and special yoga batches for students or girls she is conducting at very pocket friendly fees, especially for the students. So if you are interested in that, you can contact her. You can take screenshot of this slide also. You can WhatsApp her, then she will tell you the details. Okay. Yeah, disclaimer, आजकल ये जरूरी हो गया है. No copyright infringement intended, and this is all for the educational purpose. References हो गए. Okay. So the question and answer. I hope everyone has enjoyed and got something to learn from this session. So now I am open for question and answers.
Thank you so much, sir, for all the information. While this guest lecture has been put up for 4 5 days in the group, we have collected some questions from our girl students from all the classes. And girls who have doubt right now, they can put up in the chat box if you have any doubt. Just put it all your questions appropriately to sir, and we'll see that if the time limit is there, sir could answer all the questions. So there are few questions that I have collected and few Priyanka ma'am have collected. So we'll be asking to you from student side. So the first question is, does the color of bleeding actually tells about your health? Like there are a lot of right now articles and all over there is information that if your color of bleeding is this, your color of bleeding is that, then there are some suffering that is happening.
Right. Okay. So color of the bleeding is also very individualistic, and as said earlier, biology is not mathematics. So अरे ऐसा है तो ये, वैसा है तो वो, ऐसे तुरंत आप कोई निष्कर्ष मत निकालो उससे. लेकिन बहुत ही अगर आप ब्लैकिश और विथ वेरी ऑफेंसिव स्मेल है, तो it needs to be addressed and treated. और इसके साथ वाइट डिस्चार्ज बहुत हो रहा है, या बहुत ही ऑफेंसिव स्मेल है, या बहुत ही व्हाट वी से पतला ब्लड है, तो ऐसा अगर थोड़ा सा डेविएशन है तो इट इज नॉर्मल. कम ऑन. सो ऐसे थोड़ा थोड़ा फ्रेश, मतलब ब्राइट रेड होना चाहिए या डार्क रेड होना चाहिए. इट टेल्स अबाउट योर हेल्थ. सो या अप टू सर्टन लेवल इट टेल्स, बट ऐसा कुछ नहीं कि थोड़ा सा अगर चेंज हो गया तो उसमें डर जाने वाली कोई बात नहीं है. बट एज आई सेड कि बहुत ही डार्क ब्लैक या बहुत ही पतला है, या उसके साथ ऑफेंसिव स्मेल है बेसिकली, तो वो एक इन्फेक्शन डिनोट करता है, एंड आप उसके लिए डॉक्टर के पास फिर जाना चाहिए. अदरवाइज इट इज फाइन.
Sir, is it normal? This is the second question asked by one of the students, that is it normal that every month I'm getting my periods, but every month the dates are changing?
So the dates, how much dates are changing? You need to. Very good question. It reminds me of telling you about the period tracking app are available. Various apps are available on Play Store, like Period Diary or something like that. So you can track your period in those apps. So now the technology has advanced, so you can track there. That will be very convenient for you to diagnose your
Period cycle.
period cycle.
Right.
And see, so the every month if she is getting period, but the days are between these days, then it is fine. But lesser than this or greater than this, then the treatment is needed. Otherwise it is fine at this age. Yeah.
Sorry, I was on mute. So there's another question asked by a girl from SY BAF that, sir, if I'm getting my periods only for 2 days in a month, it's regular, but all my family members are getting, all the girls around me are getting their period cycle for like 4 days or 5 days, then there's something wrong in my period cycle?
Yeah, there are chances something can be wrong. So the age, what is her age?
She's in SY, so maybe her age must be 18, 19.
18, 19. But if you are getting only 2 days, the spotting and all, if it is included in that, and only 2 days, then I will suggest you to just go to your gynecologist once at least. Then after checking, uh, if because only one thing cannot denote, oh, this is something diseased. So if other things are matching with that, then
Yes.
you need some treatment. Otherwise, but I will suggest you to go to your gynecologist if the days of bleeding are only 2.
Sir, there are few doubts that are put up right now live on the chat box. I'll address them also. So
Yeah.
Faiza has asked, sir, like for example, menstrual cycle is said to be for 28 days, but is it okay if my cycle is for 30 days or 32 days? It's normal.
Yeah, it's totally normal.
Okay, so thank you so much, sir. Faiza, you have got the answer. Also, sir, one student has asked, could you suggest some apps like name of the application where period tracker, we just discussed about it.
Yeah, okay.
Um, and so with that, I would also say that one student has asked that after 15 days, when I get my period, I have very bad stomach pain. Is it okay?
After how many days?
15 days of her periods.
After 15 days of
Her periods.
end of the bleeding.
Yeah. Like I guess she's getting her periods, and then after that 15 days she's getting stomach pain. Generally we have stomach pain when you're going to get the periods,
Before
right?
menses.
Yeah,
Yeah,
and
yeah.
she has it after 15 days of her periods. So
And if she's getting this 15 days pay after 15 days
yeah,
at every cycle,
yeah,
then it needs to be treated.
yes,
Otherwise it can be due to other abdominal issues also, that अगर एक दो बार ही हुआ है तो
yeah.
other abdominal issues या digestion issues can be also there. So but if she is getting accurately after 15 days at every cycle, then yes, she needs to go to a doctor.
Okay, and sir, Rupa has asked, sir, is it normal that I'm getting my period 1 month and then another month I'm not getting it? So I guess she's getting it alternatively. So
Alternatively. So
is
yeah. So in the beginning of the menstrual
session.
age, so this can happen for few years. So
Hmm.
if the age is not more than 25 or something like that, uh, in the starting phase this can happen. But if you are recurrently getting in the same way, that alternate हमेशा ऐसा ही चालू है आगे भी, वो
Hmm.
रेगुलराइज नहीं हो रहा है ऐसा आपको लगा, along with that जो बाकी पीसीओएस के बारे में जो सिम्टम्स बताए थे कि
Hmm.
वेट गेन हो रहा है, अनवांटेड फेशियल हेयर्स आप है, या लीथार्जी आप महसूस कर रहे हो, या उसके साथ या इधर गर्दन पे ब्लैकनिंग ऑफ स्किन होता है. सो ऐसे कोई आपके सिम्टम्स है तो फिर उसके लिए ट्रीटमेंट जरूरी है. अदरवाइज फिलहाल मतलब ऐसे स्टार्टिंग फेज में रहता है इरेगुलर, इट विल गेट रेगुलराइज्ड आफ्टरवर्ड्स.
So I guess Neha, your question is also answered here. So there is a last question that I would like to ask you. Yes,
Just a minute. Are you able to see my screen? Those
yes, sir.
mobile applications.
Yeah. So one of the student who had asked about the
Ah,
tracker application, the answer is right on the screen, so you can take a
yeah,
screenshot of it.
screenshot. Hmm.
Sir, one of the last question that I would like to address. One student has asked, is it okay, sir, to have medicines that can postpone or prepone your periods, and how often you can take it?
Yeah. So the basically we are doing that against the nature. So अगर थोड़ा सा नेचर वाइज हम देखेंगे तो इट इज नॉट रिकमेंडेड टू, मतलब ये खिलवाड़ हो गई अपने पीरियड्स के साथ. लेकिन प्रैक्टिकली देखा जाए तो ऐसा करना पड़ता है बहुत सारे फीमेल्स को, क्योंकि अभी आपकी एग्जाम है, सपोज या किधर ट्रिप है, कोई ओकेजन है, तो वो हार्मोनल पिल्स लेने पड़ते हैं. बट ट्राई टू use it as less often as possible. Try to minimize its use. Okay.
Okay, so I hope students, most of your questions are answered. Thank you so much, sir. You have answered almost all of them. Sir, I would request, could we have a picture with all the students and you? So I would request the students to switch on their video for like 1 minute, and we can have a picture with sir.
Yeah, sure.
Rupa, if you have a doubt, you can put it in the chat box, and we have time. I will surely address it to sir. Students, could you please switch on the video for a minute? Also, students, while you're switching on the video, I would like to inform you there is feedback form link given in the chat box. Go ahead and fill it. Copy paste it if you want to, and after the session, you can calmly fill it in. The feedback form would be open. Okay, everyone, please switch on the video and I'll take the picture. Okay, thank you so much, sir. Thank you so much, students.
Yeah.
I would now request Priyanka ma'am to go ahead with vote of thanks for the session.
Thank you, Anipriya ma'am. This brings us to the end of a wonderful session. I take this opportunity to thank Dr. Vishal Kelkar for taking his time out and accepting our invitation all the way from Pune to be the orator for the program Un Dino Ki Baatein.
Yeah, it's my
Sir,
pleasure.
Sir, you have spoke about many things, including menstrual hygiene, then PCOD, then how homeopathy as a branch of medicine can help us to overcome period or menstruational problems. And I would also like to extend my gratitude to our principal, Sir Dr. Sunil Karve, for guiding us in all possible way for this session to be organized successfully. And my sincere thanks to IQAC and the Women Development Cell. And how can I forget our students? Thank you so much, students, for participating in this session. And once again, thank you so much, Vishal sir. And students, I can see you have a lot of questions. What you can do is, you have seen that Vishal sir has already shared his contact details. You can contact him. I'm sure sir will be very happy to address your problems.
Yeah, sure.
Yeah, thank you so much.
Yeah, if someone wants, I will share it. You can ask me anytime on WhatsApp. Obviously, phone call हमेशा आंसर करना possible होता है, ऐसा नहीं.
Sure.
But you can ask me on the WhatsApp. These are the details.
Thank you.
Yeah.
Thank you so much, sir. Personally, we have got a great feedback, and I think the students are not very satisfied with just one session. I hope you make time for future sessions also so that we
Definitely.
can resolve more queries that students have. And it was a pleasure to have you. Thank you, all the students. Thank you, Asha ma'am and Priyanka ma'am, and all my colleagues to be a part of this session. I would now end the session right now. Again, I would request all the students to fill up your feedback form. The link is given in the chat box. Thank you so much, sir, for sparing your valuable time.
Yeah. Thank you. Thank you to all organizers and Dr. Sunil Karve sir for inviting me to this wonderful webinar and to share my views on this very, very important topic of today's topic. Yeah. Thank you.
Thank you so much, sir. Okay.